Robert Smith was injured in a car accident over 20 years ago, which left his right femur shorter than the left femur. He suffered with pain for many years but was reluctant to have surgery until he met Health City Cayman Islands Chief Orthopedic Surgeon, Dr. Alwin Almeida.
Yeah, it was actually, people might call it a coincidence, I call it a blessing. I'd actually torn my left rotator cuff about a year and a half ago and went immediately to Health City, and that's where I met Dr. Almeida. Of course, he took very good care of that, and I'm fine now, everything is working great. But during the course of my getting to know him and getting treatment for that injury, I told him about what had happened to my leg.
We really had a great relationship as a doctor and patient, and then he mentioned to me that you know what, by the way, I have a short leg, and which I didn't notice because he was using a shoe raise on one side, and then when I actually measured it, we realized he was almost about an inch or more short on one side.
For many years, the Lazarov apparatus was used in limb lengthening surgeries. Wires and pins were used to cut through the skin, and in some cases, this would result in complications and pin site infections. After reviewing Mr. Smith's case, Dr. Alwin felt he would be a good candidate for a novel limb lengthening technique using a magnetic nail.
This one allows the same lengthening to happen without disturbing the normal anatomy of your body. As you can see, it has two rods, one the longer rod and a shorter and a smaller diameter one, and which are telescoped into each other. So you can see it when I do this, you can see it move. So it's actually telescoping into each other. And it has slots here through which we put bolts that anchor the bone to this area and the bone to this proximal portion. And then you can lengthen this slowly over a period of time with gears that are located in here. And these are magnetic gears, so you can see that it's actually magnetic there.
After the surgery, Mr. Smith says his quality of life has definitely improved.
You know, I'm still in a bit of a healing process. We're almost fully there. But already I can see that, you know, I can move around. I don't feel my body, you know, being imbalanced. I'm still working on my gait, or, you know, the way that I walk. But that's simply because of just really getting used to a new leg. It's weird. For so many years, I've been used to walking imbalanced. So my body is basically learning how to walk balanced again.
And Mr. Smith says he's grateful to the team at Health City Cayman Islands.
In terms of professionalism and capability, I mean, I don't think I could ask for better. They've gotten the job done, but more than that, just interacting with Dr. Alwin and the medical team has been a joy because they make you feel comfortable. They actually have an excellent way of asking you questions. You can see that they really have a concern about you as a patient, and I think that's what makes the difference.